According to the CDC, 1,051,875 people in the United States have been diagnosed with HIV and AIDS since the disease was first diagnosed in 1981. They have also estimated that 583,298 people have died from this disease. In 2010, 1,141 people in Louisiana were newly diagnosed with HIV, 71% of these being men. There were 5,180 women newly diagnosed with HIV infection in 2010. By city, Lafayette came in at number 4 with 337 women newly diagnosed. AIDS is a disease caused by an HIV infection, also known as a human immunodeficiency virus. People with HIV are said to have AIDS when they develop certain infections or cancers when their CD4 count is less than 200. This CD4 count is their T cell count, and T cells are white blood cells whose main function is to fight off infection. The HIV attacks your T cells and uses them to make copies of itself. HIV and AIDS are caused by multiple things. Most people get the virus by having unprotected sex or by coming into contact with infected blood, semen, vaginal fluid, or even breast milk. Another form of transmission is by sharing needles with someone who is already infected. While there is no vaccine to prevent an HIV infection and no cure for AIDS, it is possible to protect yourself and others from the infection. Some ways may include using a new condom every time you have sex. If you're HIV positive, make sure you tell your partner before you have sex. Use a clean needle, and if you use a needle to inject drugs, make sure that it's sterile and don't share it. You may also want to consider seeking help for your drug use. If you're pregnant, get medical help immediately. There are certain precautions to take to significantly reduce the risk of your baby contracting the virus. You can also consider male circumcision. There's evidence that has been found that male circumcision can help reduce a man's risk of acquiring HIV. Like we said, there is no vaccine to prevent an HIV infection, and there is no cure for AIDS. However, consider using the drug Truvada. The use of the combination drug Truvada can reduce the risk of sexually transmitted HIV infections in those who are at high risk. If you are interested in Truvada, talk with your doctor about the potential risks and benefits of the drug. A lot of people infected with HIV develop an illness that presents itself like a flu within the first 2 months after the illness has entered the body. These symptoms may include fever, headache, muscle aches and joint pain, a rash, a sore throat, swollen lymph glands, mainly on the neck. As the virus continues along its path and continues to destroy more cells, the list of symptoms grows to include diarrhea, thrush, shingles, and weight loss. If you go on to receive no treatment for HIV, it takes about 10 years for it to progress into AIDS. By this time, your body is susceptible to all sorts of infections because your immune system has been so compromised. Remember the symptoms we talked about earlier? They get even worse. Added to the list of symptoms is white lesions on your tongue and in your mouth, soaking night sweats, and skin rashes or bumps. Did you know? In the U.S., a woman tests positive for HIV every 35 minutes, and there are more than 35 million people who live with HIV worldwide. If you think you may have been infected with HIV or you are at risk for contracting the virus, see a healthcare provider immediately. Almost 1 in 6 people do not realize that they have already been infected with AIDS. Do yourself and your loved ones a favor. Get tested and encourage others to do the same.